for the beginning of your journey. And in front of you, imagine a door. Oh, it's a beautiful door. It's made of mahogany and it's polished. And that door has a brass knob and lock. Just gorgeous, polished and glistening. And you just put your hand on the knob and you turn the knob, and guess what? A door opens. And you see 5 steps reach down into a room filled with dials and gauges all over the walls. And in fact, there are so many dials and gauges you can't see them all consciously. And as you begin walking, yes, go ahead. As you begin walking down those steps, you notice that each dial or gauge is labeled individually. One is labeled cholesterol. One is labeled blood pressure. One is labeled knee joint, and so forth. And you look around you and you realize that you're in some sort of a control room. In the middle of the control room is a desk. And on that desk is a book. And you go over to that and take a look at the book. And the book has gold lettering. And the lettering in gold is your name. And you open the book, you found that it's a book of you. And every page tells you a little bit about each part of you, your body and your mind. And each page refers to a specific dial and the location for that dial. And you find the pain that you've been having, maybe big, maybe little, I don't know, but you look it up in the book and it tells you go exactly where, and you go there. And sure enough, there's a dial and a lever. And it says, it's labeled whatever your pain is. And right now, look at that dial and see what that number is. On the dial, it's registering your pain. It could be 1, it could be 10, it could be 100, I don't know. Wherever it is, there it is. And right now, go ahead and grab hold of that lever and push it up just a teeny bit and see if the pain increases a little. You may notice that it does. Now pull it down and let the pain decrease. Put it all the way down until you can barely feel the pain, just enough so you know it's there, but not enough to hurt you. And go ahead and push that lever back into the wall so it locks the dial. And notice that the pain is decreased. You know it's there, but it's gone. For all intents and purposes, all the agony and the hurt's gone. And with a big smile on your face, go ahead and smile if you're happy about this. Yeah, you can be happy, you can smile. You walk back out the door into the beautiful sunshine of the enchanted forest. And whistling a happy tune, you walk off into the sunset. Yeah. Okay, take a big breath. When I say 5, counting from 1 to 5, you just come right back in the room. 1, 2, 3, 4, 5. Open your eyes. How many of you were in the control room? Anybody? Anybody there?
Side of life.
Yeah! You're the man! Okay. There's another gift, okay? So let's talk about termination, because I'm running out of time, I know.
For me, as I was coming out of the room, it's just like...
What you do is during the termination stage of your business with your client, and I don't know how long it lasts. How many of you learned in your hypnosis training that hypnosis is instantaneous? You can cure the world in 1 session. Well, maybe, yeah. That's never been my experience, but I've heard of people doing that. It takes a while. One of the things I noticed when I moved into my new neighborhood is everybody I met told me all about themselves, but they were not interested in me until after a while. After we'd seen each other a couple times and we built rapport a little bit. And then they started asking me about me. That's the same thing with your client. It takes a while for the client's unconscious mind to say, okay, I'll give this person a chance. I'll check it out. So keep that in mind, it's always about the client. Okay, post-hypnotic suggestion to strengthen changes. Suppose someone came to you and you found out they had anxiety because they told you that earlier in their life they had been abused by somebody, either sexually abused or physically abused or something. And now you've released all the negative emotions. You don't erase the memory, but you've erased the negative emotions. And now they're ready to go on. They say, bye. See? Nice knowing you. So, but what do you do now? You give them post-hypnotic suggestion. I know you can be doing that all along, but specifically at the termination is when that really is important. You give them post-hypnotic sessions. And one of the things that I have them do throughout the whole time, and I enforce it, the last day is the COUE, C-O-U-E accent mark. Okay? Every day and every way you're getting better and better. Every day and every way I'm getting better and better. You say it every night before you go to bed. It works. And I give them post-hypnotic suggestions to do that. And here's the important thing that a lot of people in the business don't do anymore. I don't know why. But when they're done, say bye. Well, what I do is I say, bye, see you in a month. And they come back in a month because they need to be tuned. Because the changes that you affected with them are permanent changes, but that old stuff's still there. It isn't all gone, I found out. It's not bothering her, but it's still, you know, you need to make sure they're tuned. So when people do that for 6 months afterwards, I have them come back once a month. Then after that, who cares? But one of the things that you're going to discover when that happens, they have other problems they need to have taken care of that they didn't know. So that's it. So one of the things, I have one last thing to say about this. Please consider this. NGH preaches, rightfully so, that you're not doctors. You don't cure people. You're not medical practitioners. But we have this tool that we can use because it belongs to the client. We are operators. We used to be called operators instead of hypnotists. It is true, we're operators. Okay? And we can help the client use their hypnosis. And since you don't have to diagnose, when someone comes into you and says, I got worries, okay? I know the DSM, that's the the DSM, that's the big Bible of the psychiatrist people. It says worries a dysfunction, that's baloney. Worries not a dysfunction. If they say, I got worries, you can help them. You can help people stop smoking and lose weight, but you also help people in other ways. Just think about that. Just remember, you're never a doctor. And you're going to run into times when people are going to have a problem that they really should be seeing a doctor, but they don't know it. You better tell them. Okay. So that's it for guided imagery. I hope that you explore some more guided imagery. I hope you do. Now I have questions. Anybody have a question?
Now my question was, you mentioned that you start with guided imagery when you have the phone call.
Yeah.
And, someone calls you.
Yes.
Tell me a little bit more about that.
When someone calls me and they're telling me about their problem, I don't know if you have a form that you use. Carol and I developed a form that we must have stolen from somewhere, right? Steal everything is great. Okay? But this form is, you write down all the things that the client's telling. There's a bunch of questions you ask them. I think there's 15 questions I ask them. And those questions, after 2 or 3, I start to, well, can you envision your problem? And they envision. How do you describe what you see? Describe what you hear. Describe what you feel. Oh yeah. I tell them to do that. Hey, well, I've had people say, well, why do you want to know? I said, well, the only way I can help you is if I know if I can help you. So have them, anytime that they're telling you things, you have no clue what they're talking about. Okay, most of the time they don't know how to say the things, but you can have them visualize things and describe that. Then they can do it. And sometimes on the phone I have them breathe, do some breathing.
Heavy breathing.
Oh, yeah, heavy
You
breathing.
got it all.
That's not what they're wearing.
You got it.
That's for the telemarketers.
I learned that, I learned a long time ago. But I have the breathing exercises on the phone.
Yeah.
Were there any other questions?
Telemarketers.
No other questions?
That's a good
Comments?
suggestion for people who can't pinpoint their feelings.
Say again
though.
now?
That's a good suggestion for people who cannot
Yeah.
pinpoint their feelings. They don't know what they're feeling, but it's a good way to,
Thank you.
yeah.
Any questions, any comments?
Thank you.
Then I'm done.
Thank you for the handout.
Oh, wait, I'm not done, I'm not done. Hold on a second, I forgot something, I gotta do the commercial. Okay, everybody got one of these things, okay?
Yes.
Sometime in the next couple of months, I don't know when, but I'm going to be putting on a one-day seminar on imagery. It's gonna be experiential, where you will go into hypnosis and experience all these things in hypnosis. And there's right now there's about 15 different intervention imagery things that I have, not just inductions. You don't need to learn how to put people in a trance, you already know how to do that, okay? But how to utilize imagery to help people solve problems. And I have those available. That's gonna be part of this one-day course. It's gonna be $195, but if you are interested, you're not committing to anything, it's $150 for the day. It'll be in the general area, okay? So if you're interested in that, and want to get on my list, so I can, and I'm not gonna send you an email every 5 seconds telling you something. Just fill this out with your name. You can use your first name, first and last, whatever you want, and your email address, okay? And give it to me before we leave. Okay, now I'm done. Thank you.
Thank
Okay.
you.
Thank you, Paul.
It's like it,
Wasn't sure.
Oh, we can
Sorry
shut
about the
that off
sound
if
on
you
the
want.
tape. My name's Annette Olson. I've been here once, maybe almost a year ago, and took the course from Cheryl and Dave, Larry, and we say hello down from Missouri. They're a visiting family, and she's doing a course tomorrow.